Miss Cleveland needs you here, Miss Sumler. She's inviting in random people into the meeting.
Just invited a tourist. Come on in. Buddy just wants to learn about the NWT, and now he's in a opioid meeting. Good morning and welcome to this meeting of the Standing Committee on Social Development. My name is Caitlin Cleveland and I'm the chair of this committee, and today we will be discussing Bill 72, Opioid Damages and Healthcare Cost Recovery Act. Joining us here today we have Ms. Monica Piro, who is the Director of Child, Family and Community Wellness for the Hay River Health and Social Services Authority. Before we get started here, I would love to turn the floor over to my colleagues to introduce themselves, and I'll turn the floor over to my Deputy Chair, MLA Knockleby, to start. Thank you.
Thank you. Good morning, everyone. I'm Katrina Knockleby. I'm the MLA for Great Slave.
Lisa Semler, MLA for Red Lakes.
MLA Bonner.
Ron Bonadros, MLA Detro.
Jane Oyellen Armstrong, MLA for Mopi.
Excellent. Thank you so much, everyone. And I'd like to thank Ms. Piro for joining us here today and for agreeing to do a presentation before committee. We really appreciate the opportunity to hear from stakeholders and community members. And so with that, I would love to turn the floor over to yourself, Ms. Piro. Thank you.
Thank you. I want to just let people know that my professional background is as a clinician, educator, and administrator here in the community of Hay River. That said, I certainly don't consider myself to be an expert of any kind on the matters we're discussing. What I'm hoping to do instead is to provide a compendium of the voices of my colleagues and the clients that we serve here in our community, who are on the front lines and have observations and relevant reflections on the situation at hand. I don't really know that much about policy setting at the territorial level. This bill is in line with many bills that are being introduced in other jurisdictions that have also seen some success come out of them with respect to remunerations for offsetting healthcare costs. And what I'm going to suggest to the group today is that perhaps this bill does not in fact go far enough in terms of recouping costs of this opioid crisis in the territories. There are some very obvious and overt costs that we're seeing billed back to taxpayers. Those, of course, are inpatient stays for people who need to be hospitalized as a result of addiction brought on by opioids. For many people, current addiction to illicit drugs began as a prescription drug usage that really escalated, and the addictive quality of these particular pharmaceuticals are such that now people are often faced with seeking these substances illicitly on black markets and such with our drug trade. So not only has this taxed our medical system with respect to nursing, our doctors, the medications and supplies needed to ameliorate addiction, but looking at the costs of, for example, ambulances in Hay River, our ambulance system is run by a group of volunteers. Looking at the costs of postmortems and toxicology reports that have been required to really assess this for the crisis that it has become. So there are a lot of hidden costs as well. Medivacs, almost everyone who's seriously ill in a rural community does end up getting Medivac to Stanton and to Yellowknife. So there is such an assortment of related costs on the medical side that we don't necessarily stop and consider. What I would like to address perhaps at this time is the sort of hidden or ancillary costs, as I understand them to be based on my time in this community. Now, I am very much a Southerner. I'm a settler to these lands. I've only been in the community of Hay River for roughly a year and a half. So my experience is gleaned from pretty much that period of time, and this community looks very different than it did even a couple of years ago. So what I would look at is the costs in terms of the mental health aspect of what we're dealing with. I manage our team of counselors, community wellness workers. I manage the social work team that looks after child welfare and vulnerable children in our community, as well as the Healthy Family Program. So starting with our counselors and community wellness workers, These professionals deal daily with people experiencing the darkest hours of their lives as a result of addiction. They grow up surrounded in many cases by dysfunction brought on by poverty, violence, and untreated mental illnesses. I refer to these things literally as the trifecta of terror. When they finally find themselves in a place where they can embark upon a healing journey, these clients are met with many obstacles. They are required to go out and get ID if they've lost their ID or never had it for any reason in the first place. This includes a valid government ID, driver's license, or a healthcare card that's current. Those items are needed for people to be able to begin an out-of-territory treatment application. Then it's a matter of getting people to show up for appointments when they're already struggling for addiction, to get an orientation towards what treatment in the South looks like, since we have no facilities here in the territories. That involves being vulnerable. It involves doing intakes. It involves filling out forms when sometimes literacy is a problem. If the person is able to get through all of those hoops and get scheduled to go down south, many people are leaving the north for the first time. They've never been on an airplane. They have to make connections to get to Calgary, Edmonton, Vancouver, one of the other cities where they fan out to their ultimate terminus at a rehab facility. Then they get there and they realize there is structure, a tremendous amount of structure. They are not able to smoke whenever they want if they happen to smoke. They're going to be required to do chores. They're going to be required to sit in sharing circles and groups with complete strangers and be perfectly vulnerable. So these are all things that are difficult for people who've never had to experience that before. On top of this, we're dealing with wait lists. So in that moment that somebody who's contending with an opioid or other addiction is finally able to take that important first step towards treatment, they're not going to be able to access it right away. There are wait lists. There are always facilities coming off the approved provider list as well. So we never know where that's sitting. So it's frustrating for people to have no formal detox services in their communities, and also frustrating for them to have to wait for a bed somewhere. It could be weeks, it could be longer than that, and just to get them there and back safely. Now, say you do complete treatment, which is by and large not the case with the vast majority of people that we send out, at least in Hay River, for various reasons. People aren't acclimated to the vigors of the situation and of the facilities. They come back and it's difficult for them to maintain their sobriety because we have limited or no aftercare services. They are forced to go back into those dysfunctional environments where there is no housing, or housing amongst other people that are continuing to use substances, thereby making relapse for many people inevitable. So this is a larger issue with respect to recouping costs around housing, around aftercare, around possibly, hopefully looking at being able to provide these kind of services to Northerners on their own lands. Because to have to go south and immerse yourself in an urban environment in many cases, or be in unfamiliar settings away from familial and family supports, is very difficult. So that's the next phase of it, is our mental health piece. Also manage a team that looks after all the vulnerable children and youth in this community across in surrounding areas, including Enterprise. And I can share with you that the vast majority of children apprehended here in approximately the last year has been as fallout from our ongoing drug crisis here. This is at a time when our foster care system here in the North is so completely overtaxed. We have more children than we should have in foster care family situations and households where there are, in theory, limits to how many children can be placed there. But at this time, we have no options. So our caring and devoted foster care providers are very overwhelmed. We are doing our best to provide respite services in this case because they're very much needed, and work on alternate care arrangements. But the reality is when addiction is present in a family, it's often present in different branches of that family as well. and different generations of that family. So we struggle under Bill C-92 to be able to house, especially our Indigenous children, in their communities and culture that they're already familiar with, because the options become so limited. So this, for me, has been the saddest consequence of this drug crisis, is that we have so many children in care who are awaiting that healing journey for their parents, because we're not able to reunify many families because they're not far enough along into that at this point. There is the cost for us of resources diverted from policing in our community. We recently had a very large drug takedown in Hay River a couple days ago. The danger this presents to the police here, to the public here, the frustration around the petty crimes that are being committed in order for people to desperately finance their drug habits. This has had a serious impact on the landscape of policing here in Hay River. And just the trends that I'm noticing. So a lot of our work in the community and my work around building capacity in this community is really centered on what youth are going through here. It's difficult enough for young people who have no agency, who have no legal rights or options until they become adults, to be able to escape a lot of challenging and adverse situations around poverty, again, mental health, violence in the home. For a lot of these kids, it becomes a logical choice to become connected with the criminal enterprises that have infiltrated our communities. These young people are being groomed to be the next generation of traffickers and to create that demand for the next generation of drug users. We're seeing youth being arrested here with respect to trafficking charges and distribution charges. So this, to me, has become a problem that originated with fentanyl as a pharmaceutical, which has now taken its place at the top of the list of illicit substances that are being circulated, used, and wreaking havoc upon our communities. So our response to this at my level and with respect to our wonderful community partners is that we do our best to literally cobble services together, because there are funding deficits. We can only do so much when there is no safe housing for people, when there is no appropriate amelioration of poverty for people, when resources are only dealt with and dispersed at the side of our desks because there's no concerted effort to be able to tackle this problem head on. And it's sad to me, because we have a concerted, very active, very well organized criminal presence in this community and other communities in the North. And for Hay River, which is the hub of the North, I feel like we are very much ground zero in terms of this problem spreading to the rest of the territories. And alongside of that, I very much want to be at the front of trying to come up with solutions and responses and ways to deal with it that can be perhaps emulated in other communities as well. So I hope I haven't taken up too much of your time. My job is to instill hope in this community, and I intend to do my best with that. But it really has been a struggle. This is far beyond just a medical problem and recouping medical costs, because this is spider-webbed out and infiltrated our culture and our society here in every which way. Thank you.
Thank you so much, Ms. Pirro, and thank you for taking the time to join us here today. I think that so many Northerners would echo exactly what you've said today, in that the issue with drugs in the territory is so far-reaching into everybody's lives, and it doesn't affect you directly, it definitely does indirectly across the territory. And just for people who are new to Bill 72, which is the Opioid Damages and Healthcare Cost Recovery Act, and that might be kind of questioning how this act plays into what your presentation was today, I just wanted to quickly provide a little recap of the scope of the act here for people today. And this new act, Bill 72, will provide a statutory basis to sue manufacturers and distributors of opioid drugs directly for opioid-related wrongs, provide the ability to sue opioid producers and distributors on an aggregate basis without having to identify particular insured persons who suffered harm, provides a simplified formula to determine the individual share of liability for each opioid producer and or manufacturer named in a lawsuit, provide the ability to base claims of harm on statistical and sociological data, and extend limitation periods applicable to actions based on opioid-related harm. And I think one of the things that's really important here that we kind of have reminded ourselves of how do we navigate this is this piece of legislation is also mirrored in other parts of the country that are all coming together in class action lawsuits to be able to hold opioid drug manufacturers accountable for what is happening. But one of the things that you spoke of absolutely is there are far-reaching costs to this that extend beyond just the GNWT. There are NGOs, there are RCMP that are also bearing the cost. There are, as you say, volunteer ambulance drivers. And as you get into smaller and smaller communities, absolutely, still volunteer doing ground ambulance services across the territory. And so I want to thank you for raising that, because one of the things that the bill does not address is where these dollars go at the end of these class action lawsuits and how they're dealt with within the GNWT. With that, I want to be able to pass the floor to my colleagues for any questions or comments that they might have at this time. And who would like to start us off? Emily Knockleby?
I was going to let Lisa go first with her nursing background. Thank you very much for the presentation. I think you've raised some really good points about where maybe this bill is lacking. And I'm not sure, given the process of what we do as a committee, that we have a lot of effect on trying to change the bill in order to capture all these indirect costs. But I do think you've given us a lot of information to take back when we have discussions, at least with the department and the minister. I'm not sure that I really have any questions. It's just a lot more of wanting to acknowledge the things that you said, and that they are the same things that we as a committee have been hearing repeatedly when it comes to youth, when it comes to addictions and treatment. I'm currently trying to get a few of my constituents and other residents into treatment, and it's actually 4 months currently. I called a facility yesterday. And if the person gets on the list now, they'll have 4 months. So we are reaching a pretty, I think, critical and dire point. And hopefully the government is listening, and that some of the points that you've made here will be taken back into the department for consideration of really, does this bill go far enough? And perhaps there's some way that they can change or do something even further to capture some of these costs. Again, I just want to say on our side of the house that we have been a huge proponent and supporter of giving money and funding to the NGOs and to people and groups that are trying to address this problem in that piecemeal fashion. But I think we're sorely failing at this point. It's kind of like I liken it that we're standing in front of that leaking dam, and random people are putting their fingers in the various holes, but overall the dam is deteriorating. So, I just want to say thank you for the work that you're doing, and a lot of points to take home. And yeah, no questions, but I applaud the good fight. So thank you.
Thank you, thank you, Emily Knockleby. Ms. Pirro, do you want the opportunity to respond?
Just raising the point, something that came to mind as you were all speaking. Our helping professionals are also members of our communities as well. And we're really looked to provide the solutions, to provide answers, to carry the weight. And it feels like a very, very heavy weight at this time. I just think it's crucial at this point to focus on our youth. We've had a lot of supports brought into our community through the Chief Public Health Office and the Chief Coroner. I really appreciate that people have taken the time to come here and get boots on the ground. We have supports through a grant for 2 community outreach nurses that will be doing work around naloxone education and helping us to orient services in a way that we may not have thought of. And for me, it's exciting to see this level of collaboration and the community coming together, because it's imperative at this time There is a lot of talk of resurrecting. We have a lovely facility in our vicinity that could be invigorated as a treatment center of sorts. And I think the importance of those community partnerships at this time and working on building rapport and trust, especially for me as someone who's still relatively new to this community and learning about all of its nuances. But yeah, recognizing that the vicarious trauma exposure for all of our helping professionals is by and large monumental. And part of what we also have to manage is keeping our helping professionals healthy and grounded and able to do their jobs, because they really are the last line of defense in this crisis right now.
Yes, thank you. Thank you so much for that, Ms. Perro. Next on my list, I have MLA Semler.
Yeah, no, I just thank you for your presentation. I mean, this topic, it hits home. I personally lost my brother-in-law to opioid overdose, and so, when we talk about all of these things, and we put them in perspective and personalize them, and I like the way that you've personalized, like all of the way you termed it is like the auxiliary and the hidden costs, because these are what has led to where we are today. And knowing that this bill is just going to be the surface, the surface of just to see if we do change, if we create this legislation, then GNWT will be able to join in the class action. And if there is money out of that, then we can maybe start to deal with some of the areas that we know, like that you discussed, like we all know, and every one of us know, and you probably heard it time and time again from all the regular members, is that we know that there's a problem with accessing mental health and addiction services. This is why we're in the place that we're in, but nobody seems to want to change the process or make it easier. And I think that's the problem, because we're always doing things by risk. Like if we don't stay sober for 30 days before we can go to treatment, I'm like, that was when I was working in the healthcare system, that I laughed, and I'm not laughing because I'm laughing at people. I laughed because who would create some kind of policy like that when you're dealing with addictions and you're suffering from addictions? It means you're utilizing the substance every day and you can't go without it. But you got to stay off it for 30 days in order to be able to go and be approved to be sent for treatment, because your failure rate, your risk that it might cost the government more if you don't do this. So I think there's so much more that we need to do in the territory. And I think this one is just a start. And hopefully that, if we do get financial funding out of here, that we can start to allocate some of those dollars to the things that we need. So again, just thank you for being here to present to the committee and raising the issues, and thank you.
Thank you so much, MLA Semler. I also have MLA Whalen Armstrong on my list as well. MLA Whalen Armstrong, if you can hear us, we can't hear you.
Okay, yeah, I'm here. Can you hear me?
Excellent. Yep, we can hear you. Floor is yours.
Okay, thank you for the presentation. And I do understand and I hear you, because we are going through the same situation ourselves. We are going through the same issues. And I think there's a lot of other First Nation communities that are probably going through the same thing. But this is a serious issue. We need to do more. We need to do something about it, like before it gets too late, too far. And I know there are some young people that are, I know the system is saying that, some might say we're on the borderline, or maybe we're too far off now that, like our youth it's not too late, but that's just a general feeling that I'm getting from the community. But before it gets too far, I think we need to do more. And I'm very glad that you're taking your stance on this, and that and I am with you. I'm standing with you. I hear you because like all the issues that you're talking about, like just like Lisa said, 30 days. Some of them are saying, well, you need to go see health, like you need to get medical form, you need to get all kinds of documentations before you can go. And some of them are saying 3 months. And it's just the message is not the same for young people that wants to go. And now that there are some young people from my regions that they post them on the Facebook. They really want to get healed. They want to help themselves. So they're making the initiative. They're making that move. But we need more. We need to make it easy for them where they can go and get the treatment, get the help that they need. But it's just that there's too many barriers that I see that. And if it wasn't, here we're talking about a lot of indigenous kids in care. There are, if it wasn't for the grandparents, there would be more children in care. And I've said that quite a few times because even myself, I'm having issues. I have loved ones that are suffering with addictions. And if it wasn't for grandparents like me, they would be in care. These kids, like our grandkids. And it is sad. It is sad. It's not just me. There's quite a few other grandparents who are in the same situation. And we just, there's so much that we can do. And then I know there's quite a few resources here, but the only addiction center that we have access to, the indigenous focus, was canceled, and without no backup. There's no other ones like that, and that is a shame. That is sad, and we're asking, and we're just tired of the government telling us, saying no, 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 no to us all the time. It's just like, when are they gonna start listening to the people, to the young people, to the family that are struggling, suffering with addictions? If it's not, it's everybody around, within that one person, there's so many that are affected by it. Now it's not just one. There's a whole community of youth. They're crying out for help. They're talking. They're saying things. They're like, they want to go. They want to get the help that they need, but there's too many barriers. But I'm very grateful that there are some counselors here that are trying their best. They're working well with the young people. They're pleading with them. They are really trying. So I would, I'm encouraged by that. And I'm encouraged by the young people speaking up about the addictions and saying that they know they need help. They're saying it, they need help. So, that gives, that's giving us hope. And hopefully that will have a good positive effect on others. And hopefully they will follow and they will start talking about it more, the impact that it has on them. And there's a lot of grandparents that are out there in the same situation. If it wasn't for the grandparents, there would be more kids in care. We said there was like 98%. Well, it could be more than that. But we intervene. And it just, it's sad. And I'm glad that all the stuff that you mentioned, it really has an impact on us here in our communities or in most of the indigenous communities. So it's just more of a comment, but I'm glad that, that we're doing something about this, but I think we need to to do more and too many barriers. And they want us to apply for programs and services that there's a cap on it. And it's some of them, it's not too much. It's not lots, like 45K. Like, I mean, that's not too much. It's not, like even for having a suicide, or not a suicide, but a youth gathering here, even that one event costs over $100,000. And what are we going to do with the $45,000? There's a cap on it, and there's all kinds of barriers, a report and everything like that. So I do hear you. So thank you for the presentation.
Thank you so
Thank
much.
you for your kind words. And I have definitely felt that our cookums in our communities are our secret weapon. And I work really hard to build those relationships with that group because they are ready to help. They are unsure how to help. We get approached all the time. So building those intergenerational connections, I think, is crucial as well. That's a big mandate of mine because we need to put more healthy influences and mentors and Indigenous mentors into the lives of these kids who may not necessarily have those in their immediate environments. And we know that one person is all it takes to make the difference in the life of a young person who's struggling.
Next, I have MLA Bonnet Rouge. The floor is yours.
Madam Chair, and merci, Ms. Pirro, for your presentation this morning. I note that you're saying the hub at the north, and that many of the probably illicit drugs come from through Hay River, and I think we understand that in our community of Fort Providence too. We've had we never ever figured the day would come so quickly, but it has come where we had a couple members succumb to probably an overdose of fentanyl or something. And we just had another person that's out in BC right now, his family dealing with that. But I don't know, you're stating that you're a clinician. You probably have a couple positions up in Hay River. I believe that's what you were saying. But, so Hay River is lucky, they're fortunate, I should say, in that they have clinicians. I always said that about the diabetes program, which they don't have in the small communities as rigorous as the Hay River ones. And I've noted that in the member statement on the floor too, that Hay River had one of the best diabetic programs, as they have clinicians, 2 or 3 dedicated to that in the community of Hay River only. And as your case, you're doing the one in Hay River. So it seems like any positions created are always just in the larger centers, the regional centers. Because there's nobody helping us in the small communities, even though we cry about getting help for our communities and positions into our communities to no avail. No education in our small communities regarding, all these drugs and everything, nothing coming from the health centers or the Digital Health and Social Services Authority. To educate our people and what they have for services, because nobody comes here from these centers to give us a helping hand or educate our people or have public sessions. There's nothing like that happening. So like I say, Hay River and the larger centers are very fortunate that they get all the positions. I guess the act here is regarding recovery to give the GNWT the ability to sue manufacturers or recover funds dealing with the opioid or whatever those incidents that's costing our health care quite a bit of money. I don't know how come we didn't do the same for alcohol. It's no different. Alcohol just is, where I was saying it's so taxing on our healthcare system, yet we don't turn around and I guess government can't sue themselves for being, as they say, legal bootleggers. But so this act is looking at doing something like that, is to sue the manufacturers to recover costs, but at the same time, they're also including or extending that to try to recover from the individuals who use the drugs and who are taxing on our healthcare system. Those very people that probably can't even afford anything. I'm just wondering, since you're part of the River Health and Social Services Authority, what their comments are in relation to this act, and if their comments or their views on these issues. Let's see.
Certainly can. I would never speak on behalf of my boss. Aaron is actually in Yellowknife right now. So you're kind of stuck with me, I guess. And again, speaking to my relatively short time in the community, I know the rest of the leadership team here for the Health Authority have been in Hay River for decades, very long period of time. I think as a team, we see the connections between all of the aspects to this problem. And what you're suggesting, that a similar approach should be taken with respect to alcohol, to me is not outlandish at all. We know that alcohol is a serious addictive substance in the North and has also likewise impacted many families. How to go about the machination of that, I'm not terribly sure. As I said, I'm not involved with policy making at the territorial level. But this idea of recognizing that instead also of focusing on the substances people are using, that's one place to put attention, but also recognizing what are the compounding factors. Why is it that people are feeling the need to engage with this level of intensity with these dangerous addictive substances, whether we're talking about alcohol, fentanyl, lots of problems with cocaine and cocaine derived products here in Hay River. Drugs are used so widely because they're very successful at helping people forget about their problems. So what are the problems we need to be focusing on as adults in the room for the benefit of our youth who aren't quite as empowered yet, especially? But where does our attention need to be in ameliorating some of these societal conditions in order to see people become healthier and happier? We're always going to have addiction if there's poverty. We're always going to have addiction if people are not getting their mental health needs met. We're always going to have addiction if family violence is not ameliorated at some systemic level and trickling down into communities. All of these services are dealing with the same residents and the same clients because addiction has really become an underlying foundational aspect of service delivery. Everything here in Hay River, by and large, is connected to there being a drug crisis in this community. And until we're really taking a long look at poverty, at housing, at the struggles people have for educational and vocational attainment here in the North, these are all undercutting the scenario. And we can't look at addiction in a vacuum apart from all of these other societal factors. So what is it that's driving people to drink and use drugs? Because until we're addressing that, we're always going to have addiction to deal with and pay for ultimately.
Thank you very much, Ms. Pirro, and thank you so much for taking the time to join us here today and present to committee, and also being willing to field questions and comments from committee members as well. We really appreciate the time you've taken, and also the value of your experience working in the North and working as a frontline employee. We really appreciate not only the time you spend here, but the time that you spend working on behalf of the territory. So thank you so much. I would also like to let anybody know that is listening today or watching today that a committee is welcoming further engagement and submissions. If people would rather do written submissions to committee, they are absolutely more than welcome. The deadline committee has put for this is April 28th, which is 10 days from today. And the email address that people can do written submissions at or reach out to committee at in order to book further engagement is committees@ntassembly.ca. So thank you very much to yourself, Ms. Pirro, and to the public who have joined us here today. That is much appreciated. And could I have a committee member please move us in camera? Thank you so much, Emily Semler.